Now let's talk about everyone's most favorite topic, cervical cancer screening. So there's a lot that goes into this. So we're going to go in extreme detail and teach you everything you need to know about cervical cancer screening. Are you ready for this? So there are two types of cervical cancer. There's squamous cell carcinoma, which is the one we're going to focus on, and adenocarcinoma. Squamous cell cancer is much more common and the one we're going to deal with in a lot more detail here. So what are some tests we use for cervical cancer screening? We use a pap smear and we use HPV testing. So the pap smear is where you take a sample of the cells of the cervix and the cervical junction and test them for abnormalities. And HPV testing is where you test for the actual virus itself, which is the cause of squamous cell carcinoma. So what are some risk factors for cervical cancer? This is basically high-risk behavior of any kind, sexual or in terms of drug use. So it means infection with high-risk HPV strains such as 16, 18, 31, and 34, early onset of sex, remember sex is the biggest risk factor for getting HPV, multiple sexual partners, risky behavior such as using drugs, and also immunocompromised. Remember, your immune system actually defends you from cancer. If a cell becomes cancerous, your immune system can actually fight it off. But if you're immunocompromised, you cannot actually fight against that cancer, and you're more likely to get it. So what are some indications to screen for cervical cancer? The first one is that you start at 21 years old. So no matter what, except for immunocompromise, you always start patient screening at 21 years old. It doesn't matter if they start having sex at 16, 18, 20, anything. As long as they are 21 years old, they can start cervical cancer screening. So even if they're abstinent, they say they're abstinent, they're older than 21, you still screen them. If they've given the HPV vaccine, you still screen them. Always remember that. A lot of people are getting the HPV vaccine these days, but that does not mean you don't get pap smears anymore. And if less than 21 with high-risk behavior, you still don't screen. Only time you screen is if they're immunocompromised. Alright, so what you do, you screen every 3 years if less than 30, due to the transient HPV infections in younger populations. So you can get HPV infections, even get CIN, which means cervical intraepithelial neoplasia. You can get that in younger populations, but it goes away so frequently that you don't need to screen very often. So you screen every 3 years if they're below the age of 30. Okay? If they're greater than the age of 30, you can screen with a pap smear every 3 years, or you can co-test with a pap smear plus HPV testing every 5 years. So you have two options when you're older than 30. Because there's so much HPV infections in younger people, you don't need to do the HPV testing in them unless there's an indication. But for screening asymptomatic people older than 30, you do a pap smear every 3 years or pap plus HPV every 5 years. And if they're both negative, you can do the next thing, co-testing, 5 years later. You stop screening when they're older than 65 years old if they have the following. No increased risk, so that means they don't smoke, they don't have any history of abnormal screening in the past like CIN or screening noncompliance, or if they're immunocompromised. So if you don't have smoking, you don't have a history of a bad screen, you don't have a history of noncompliance, and you're not immunocompromised, you can stop screening when older than 65. Another criteria is that you need to have adequate prior screening. 2 consecutive negative co-tests meaning the HPV plus pap smear, or 3 consecutive negative pap tests. So 3 negative pap tests or 2 consecutive co-tests that are negative to stop screening. And also you can even do a stopping screening when there's a total hysterectomy if the cervix is removed, if it wasn't removed for a cervical intraepithelial neoplasia or cancer. So if this was because of cancer of the cervix, you still need to do pap smears and HPV testing, because you can still get the cervical cancer in the vagina. So vaginal cytology is needed if you have a hysterectomy, but you also still have high risk of cervical cancer. So only if there's no history of CIN or cervical cancer and you get a hysterectomy, and you have the cervix removed, that's when you can stop screening. But if they still have the cervix, or if they have a history of CIN or cervical cancer, screening is still highly recommended. And since there's no cervix, you can use the vaginal cytology instead. So now let's talk about the first type of finding you can get on a pap smear, ASC-US, atypical squamous cells of unknown significance, or undetermined significance. So that means ASC-US on pap smear, and you see that it is not normal, but it's not severe either. It's like the benign form of problems on the pap smear. So you have different managements depending on how old the patient is. If the woman is 25 or older, you have a certain thing you need to do. You want to HPV test them. So the first thing you do when you have a patient with ASC-US is you do an HPV test. And if it's positive, you go to colposcopy. So what is this colposcopy? Colpo means cervix and scopy means to scope. So you're going to take a look at the cervix and look for any lesions that are present. If it's negative, you repeat the Pap and HPV test in 3 years. So simple enough, right? You do an HPV test if you get ASC-US in 25 and older, positive colposcopy, negative repeated in a couple years. Now for women between 21 and 24, it's a little different. Because of the super high rates of HPV in this population, you're not going to do HPV testing, and there's also a much lower risk of cervical cancer. The younger the woman, the stronger the immune system, the lower the risk of cervical cancer. So there's a high rate of HPV infection and spontaneous CIN regression. And for this reason, we're not as aggressive with patients who are 21 to 24. So you repeat the cytology in 12 months. So you don't do anything at the moment. You just repeat that cytology, the pap smear, in 12 months. If it's negative, ASC-US or LSIL, LSIL meaning low-grade squamous intraepithelial lesion, you repeat the cytology in 12 months. Okay? And if that's negative 2 more times, you return to routine screening, which means every 3 years. So remember, it needs to be negative 3 total times in a row to return to routine screening. But if it's positive, including ASC-US in any of these screens, so any of these 3 screens here, if it's even ASC-US, again, you have to do a colposcopy, meaning you have to scope the cervix and see if there are any abnormalities present. And if you have something called ASC-H, which is atypical squamous cells, high risk, or if you have atypical glandular cells, or if you have high-grade squamous intraepithelial lesion, in all these different cases, you have to do a colposcopy immediately. Okay? So if the repeat cytology shows any of these, you do a colposcopy and look for a lesion. And if there's a lesion, you need to biopsy it. So here's some flowcharts to help you. I know the last information you got earlier is a lot of stuff just shoved at you. This will make it a little easier to digest and comprehend. So if a woman is 25 or older with ASC-US, what are you going to do? Reflex HPV testing, like we mentioned before. And if it's positive, you do colposcopy. If it's negative, you repeat the Pap and HPV testing in 3 years. So it's a nice, easy way to remember this using this flowchart. So always come back to this whenever you're looking at women 25 plus with ASC-US. Now we talk about women 21 to 24 with ASC-US. What are we going to do here? We're not going to be as worried because we have much lower risk in women 21 to 24 than we do at 25 plus. So you repeat the Pap in 12 months. And if it has ASC-H, HSIL, or atypical glandular cells, you're going to do a colposcopy. And if you have negative ASC-US, or a negative test, ASC-US or LSIL, you're going to repeat the Pap in 12 months. So if you have any of these things, you're going to do colposcopy immediately. And that 12-month repeat, if it's negative ASC-US or LSIL, you repeat the Pap in 12 months. But if it's anything more than ASC-US after those 12 months, you have to do a colposcopy. And if it's negative both those times, then you do back to routine screening. Okay? Know these charts. They're very high yield and very testable.